Hey, everybody. I am Professor Lauren Davis, and I am here to talk to you about the didactic year. So, to give you just a brief intro to what that is going to look like. I am part of the didactic faculty. I teach your clinical medicine class. We'll talk to you about what that looks like. Our didactic year is broken up into 5 units. Your first unit starts in January, and that includes gross anatomy and your diagnostic sciences class. So gross anatomy is going to be a combination of lecture and cadaver lab. That's a pretty intense 5-week course. And your diagnostic sciences class is going to teach kind of the intro to labs and radiology that we're going to talk about the rest of the year. So you'll have a foundation moving into future units. Unit 2 is where really the core classes of this program show up. And so in Unit 2, you will take basic science, which is going to be your normal physiology and pathophysiology. You will take clinical medicine, ClinMed for short, which is what I teach, which is how do you diagnose a disease process? How do you find it and diagnose it and treat it? You will take patient assessment and diagnostic methods, which is PADM for short. That's where you learn the physical exams and any other diagnostic methods that you would need. And you take pharmacology, and you take path to PA, and then you also take PBL or problem-based learning, which is that class we tie everything together. So everything from basic science, ClinMed, PADM, etc. And that's case-based. And so you work through cases and you tie everything that you've learned together. That schedule will continue until Unit 4. Unit 4, we add a pediatrics course. And then Unit 5 is at the very end of your didactic year. It's another 5-week course that we do clinical year prep, which is a lot of hands-on training. So for example, that's where we do your CPR training and your advanced cardiac life support training. We do how to gown and glove for surgery, how to start IVs, etc. In Unit 5, you also start learning about your graduate project. So that's where you'll start hearing more about that. All of our units are body system based. So for example, when we start ClinMed in Unit 2, we will start with hematology oncology. And you will be learning about hematology oncology in every one of your classes. And so in basic science, you're going to talk about, for example, the structure of red blood cell and what normal hemoglobin, how normal hemoglobin is composed. And then in ClinMed, you're going to learn how to diagnose anemia, for example. And then in PADM, or that's your patient assessment diagnostic methods, you're going to learn about the physical exams that you would need for a hemonc, pathology or extra labs that you may need. And then in PBL, you're going to have a case where you're tying all that together. And then in pharm, you're going to learn, if we're on the anemia example in pharmacology, you would learn how do you treat anemia. What else? Oh, all your required textbooks will be in your syllabus. I would say a majority, if not all of them, are available to you via Access Medicine online. I highly encourage you to find that website early and utilize it frequently. All your textbooks are there. I know the only one you may have to buy is your PADM textbook, which is your Bates physical diagnosis. But we will talk more about that in orientation. And what else? What does a normal day or week look like? So we will have classes Monday through Thursday. So you have Fridays off, you get a long weekend, which is awesome. And so Mondays, and anatomy again is going to look a little different. You're just going to be doing anatomy in that diagnostic science class. So that schedule is going to look a little different from when we get into Unit 2 moving forward. But Unit 2, you will start basic science at 8 a.m. That class runs about an hour. At 9:10, we start clinical medicine. That class is going to be 2 hours. And so that would run us to 11:10. You get a lunch break at that point. And we have a student lounge where you can eat lunch and warm up your food. And then starting at noon, on Mondays and Wednesdays, you will have PADM for 2 hours, so from 12 to 2. On Tuesdays and Thursdays, you will have PBL. Pharmacology is usually in the afternoons or evenings because Dr. Corvino still works full-time, so we will have to work around his schedule, so that's in the evening. And so that's a typical day. And like I said, you get Fridays off, so extra study time for a long weekend. I'm sure this did not answer all of your questions, but this was just to serve as a brief overview, and then we'll get into all the more specifics at orientation. All right, we will see you in January.